week? Who can give a recap of what we did last week? Blessing Kwesi. Please, can you give us a recap of what we did last week?
Yes, look. Last week you taught us about that lab is an investigation that gives us confirmation about what the practitioner is suspecting about the client, and also about the diagnosis. Diagnosis should be with you have the right tools, and then as well as other conditions. This is what I can for now. Thank you.
Okay. Who can add up? Who want to add up? Okay, Philip. Dr. Philip, you can add up.
Yeah, thank you so much, Doc, for the opportunity. I think last week I could also remember that we said that in conducting lab investigation is done irrespective of persons by not looking at age or sex. And I also remember that you also made us understand that to have an accurate and a precise result, we need to follow standard procedures at the lab. So this is a little that I could also talk of. Thank you.
That's fine. Who else? Who else? Who else want to add up? Henry, Dr. Henry.
Good evening, sir, and then good evening to colleagues. I think one of the things that I can also remember is the fact that you said it's better when you do bird lab investigation. It shouldn't just be one place. Sometimes it can be two, or so that you will see whether whatever is given. I mean, it's actual. You can compare to see which of them is actually pointing to what you suspect, because it's about you, the clinician, what you have suspected, and you want to confirm with the lab test. So when you do, and it's just one, it may be right, it may be wrong. So when you do another one in addition from some other place, you can do the comparison, and that can confirm or deny what you are talking about. Thank you.
That's fine. Who else? Dr. Christiana.
Yes, thank you so much, Doc. You also made us to understand that labs are carried out to help a practitioner to come out with an accurate diagnosis of a client's complaints. Thank you.
Okay, that's fine. So um, let's continue from where we ended last week. So today we'll look at the branches of laboratory investigations. We have the clinical chemistry, which analyzes the chemical composition of body fluid, that is blood, whole blood, serum, plasma, and urine. An example of clinical chemistry is blood glucose test, kidney function test, liver function test, etc. The second one is hematology. This studies the cellular components of blood, that is the red blood cells, white blood cells, platelets, and any other blood-related disorders. An example of hematological test is full blood count or the complete blood count. Then we go to microbiology. Identifies disease-causing microorganisms, bacteria, fungi, and other parasites, and determines their susceptibility to microbial or antimicrobial drugs. The goal is to diagnose infection and guide effective treatment. Example of microbiological test is urine culture and sensitivity, that is urine CS, or stool CS, or gram staining, to identify either gram-positive or gram-negative bacteria. Clinical pathology or histopathology or cytology. Histopathology examines tissues under a microscope to diagnose disease like cancer, inflammation, or other structural changes at the cellular level. Cytology studies individual cells or small cells clusters from fluid or scrapings to detect abnormalities. Most famously used in cancer screening. Example, the pap smear. Immunology or serology. This evaluates the body immune system. The body immune system functions and diagnoses condition by detecting antibody or antigen in the blood. Example is the HIV test or hepatitis B test, hepatitis C, syphilis, and the rest. These antigen-antibody reactions can either be IgM or IgG, which indicates current or past infections. Then we have the transfusion medicine, that's the blood banking, which is also a branch of laboratory investigation. This ensures the safe collection, typing, compatibility testing, and transfusion of blood and blood products. Its core function is to provide the right blood component to the right patients. Example, blood grouping, or resource matching, or cross-matching. It could either be resource matching or resource factors. The blood grouping is the A, B, AB, and then the resource factor is the negative or the positive. So it could either be A positive or B positive, or A negative or B negative, or AB positive or AB negative. And the cross-matching is matching the donor and then the recipient blood to see if it is compatible before it is given. Then we have the molecular diagnosis. This is an advanced stage where genetic material, that's DNA or RNA, or specific protein to diagnose disease at the molecular level. It offers high specificity and sensitivity. Example, PCR test for infectious disease. Example is using the GeneXpert machine to detect Mycobacterium tuberculosis or HIV viral load or COVID-19 testing. Then we have the toxicology. This detects and measures the presence of drug, poisons, and other toxic substances in biological samples. It is used for therapeutic drug monitoring, overdose diagnosis, and forensic purpose. Example is the drug screening using the urine or the blood test or blood samples. So the roles of the laboratory professional, we did it last week. So I will escape that side and then we move on. Importance of laboratory investigation was also done last week. So we'll move on. Then we come to some terminologies in laboratory investigation. Quality assurance, which is done everywhere. Quality assurance is a systemic or is a system and checks to make sure tests, treatment, and care are accurate, safe, and reliable every time. Quality control. Laboratory quality control is a part of quality assurance focused on monitoring and evaluating the accuracy and the precision of laboratory tests. So we have so many quality controls measures that are placed or put in place in the laboratory to make sure that the laboratory results or the laboratory test that was requested, the results that comes out is accurate and reliable, which will help the prescriber to make a decision, a very informed decision on how treatment should go. So with this quality control, we have the temperature monitoring charts. We have the control for the test, either a positive control or a negative control. For instance, I want to do a malaria test. Before I go with the malaria test, I have to do a quality control to see that the test that I'm running for that particular day, the results that will be coming out are accurate and reliable. So first of all, I will do a positive control test, and then I will do a negative control test. Doing the control test, you use a sample which is already known. You know the results of the sample. So in case you are doing the malaria RDT in your facility, you have to do the control. You have a positive control sample and a negative control sample. So before the test is done for the day, you do the control. The positive control, when you run the test with the same RDT cassette or test kit, you are supposed to get a positive answer or a positive result. And then the negative control, which is a sample which is already known, and it's a negative result. You run the same test, and then you get a negative result.
Dan, hold
then
on.
You know that
Alpha, Dan, Ofane, hold on. Please, Mike, what is happening? Dan, I think Mokonfina can just remove the person from the class. Alpha, Omega, you are disturbing the class, please. Dan, Ofane, move on.
So like I was saying, with the positive control, you already have a known sample, which is positive. And then with the negative control, you already have a known sample, which is negative. You know the results of that samples. So before the test is done, the malaria test is done in the facility, you run the test for the negative and then the positive. You are supposed to come out with the same results as the controls. So when you get the results which is different from the control, it could be a reason that the test is not well done, or the RDT cassette you are using is not working well, or there is a reason behind that. So you go back and then you check. So these controls are done to make sure that the results that will come out are reliable and accurate. And let's go to sample. What is a sample? A sample is a laboratory. A sample is a biological material. That is a portion of a biological material. It could either be blood, body fluid, urine, stool. That is a part of it that is used for laboratory analysis. So with blood samples, we have the whole blood, we have the plasma, we have the serum. The whole blood consists of both the liquid portion and then the cellular portion. And then the plasma is what we get, the liquid portion we get from unclotted blood. And then the serum is the liquid portion we get from the clotted blood, which is the serum. And they all perform different tests or are used for different diagnostic laboratory tests, depending on the kind of test you are running. Types of laboratory tests. This one, I have a few here. I'll give the class so that we all mention some few ones that we know. I have the urine routine examination, the complete blood count, hepatitis B surface antigen, typhoid, stool routine examination, hemoglobin estimation. So let me ask so that we mention a few and then we add on. Who can mention other tests that is not added to my slide? Evans. Dr.
Yes, sir.
Evans.
Yes, sir. KFT.
KFT. Please, what
Yes.
is KFT? The full meaning.
Kidney function test.
Kidney function test. Okay.
Okay. Those are the liver function test.
Christiana.
We all
Yes, please. Lipid profile.
Lipid profile. Okay. Dr. Eunice.
Kidney functioning test.
Dr. Eunice.
Kidney functioning test. Kidney functioning test. BUE creatinine.
BU creatinine. Please, the full meaning.
Blood urea nitrogen creatinine.
Blood.
BUE.
Blood what? BUE.
Blood
Yes,
urea. I don't know the full name of the E, but I know it's the BU is blood urea.
Urea. Okay. Dr. Philip.
Yeah, thank you, Doc. H. pylori, I think it's not also captured.
H. pylori. Dr. Charles Menu.
PSC, doctor. PSA.
PSA. Please, the full meaning.
Prostatic specific antigens.
Okay. Thank you. Dr. Olumide.
the pap smear,
Pap smear.
the pap smear, right?
Okay, thank you. Okay, we have Dr. Meshach Kwanzaa.
LFT, liver functioning test.
Liver function test. Okay. Thank you. So let's move on. So doing laboratory investigation, we have three phases. We have the pre-analytical phase. So these phases help the technician or the scientist to produce a reliable and accurate results. And during these phases, there are errors that comes with it. So let's look at the pre-analytical phase. That is the initial phase involving patient preparation, sample collection, sample handling, and sample transportation. It is the most error-prone stage. The pre-analytical phase of laboratory investigation, that is the most prone error stage, because that's the initial stage, the first stage. And during that stage, we have the sample collection, the sample handling, and then the sample transportation. What are some of the errors that might come out with during sample collection? Errors that might encounter during sample collections.
Wrong labeling.
And ways to avoid last opportunity to avoid them. Wrong labeling. Okay, so let's note it down. Wrong labeling. The use of the tourniquet. Tying the tourniquet for too long. Tying the tourniquet for more than 1 minute. The tourniquet should not be tied for more than 1 minute. Could also cause an error during the pre-analytical stage, that is during the sample collection. Why are we not supposed to tie the tourniquet for more than 1 minute during sample collection, during blood sample collection?
Hello, Doc. Can I try?
Yes, Dr. Charles Menu, please go on.
Okay. It will cease the flow of blood to that site where the sample is taken, or it will not, it will cease sufficient blood to the site of sample taking.
Cease. Well, my network. Dr. Eunice.
Please, I have my name.
Can you hear me?
Yes, please, I can hear you.
Dr. Eunice, your hand is up.
Yes.
We are looking at why we are not supposed to tie the tourniquet for more than 1 minute during blood sample collection?
Um,
Dr. Christiana.
Yes, please. So keeping the tourniquet more than a minute can lead to cell death due to lack of blood flow or insufficient blood flow to the rest. I mean, to the part to the other part of the hand or wherever the tourniquet is being used.
Okay. So what will happen to the sample when it is taken from that point?
Okay, can I try this, please?
Yes, go ahead, please.
Yes, so basically, because of the lack of blood flow, it will affect the lab results.
That's perfectly right. Okay, so let's look at this. One, there will be hemo concentration. The blood will be concentrated at that particular spot because you've seized the blood flow. So what is there will be concentrated, which will affect the laboratory results. It could either increase electrolytes like potassium, calciums in the body or in the blood sample, or could either cause hemolysis, that's the breakdown of the red blood cells, which could affect the results. So the results will come in and then it will not be that accurate for you to use for your diagnosis. But during the sample collection, if the sample is not taken at the laboratory personnel has no idea how the sample was taken. So the sample will be given to the laboratory personnel. The personnel will run the labs, and they will produce the results for you. So when the samples come to the laboratory personnel who has no idea whether the sample was taken or collected properly, will produce the results with the sample that was given to him or her, and the results will come to you, and it will be that accurate to confirm your diagnosis for you. Okay. What else? Sample handling. Sample handling. How should sample be handled after the collection? After collecting the blood sample, how should it be handled?
You must, you must, you must keep it.
Okay, so let me put the question this way. Sample collection. We have various blood sample containers or tubes for specific laboratory investigations. We have one for hematological purposes, and we have one for biochemical purposes. We normally use the one with the lavender cap or the purple cap for hematological purposes, and then the one with the yellow cap, that is the serum separator tube or the gel tube for biochemical investigations. So you pick a sample into the one with the purple cap, that's the EDTA tube, sample container or sample tube. How are you supposed to handle that sample after collecting the sample into the tube?
Okay, usually after blood collection, we invert the tubes. Yeah, we invert the tubes.
Come again.
We invert the tubes after we collect the blood in the tubes, right? We invert it, and this is to prevent clotting or to allow proper mixture of the anticoagulant and the sample itself. And after that, now then it, we hold it upright into a rack. Yes, that's the answer you're looking for.
Okay, that's perfectly right.
At what point, may I
Yunus,
ask?
your hand is up.
At what? I have my hand up, sir.
Please go ahead.
At what point is the tube labeled and dated so that there's no mistake with the identification?
The tube is labeled before the sample is taken. So when the client comes in, you identify the client by the name. That's the full name. Kojo Mensah. Then you label the tube with the full name, the sex or the gender, and then the date and time of collection before the sample is taken. Sample handling. We are still on sample handling. The EDTA tube contains an anticoagulant which prevents the sample from clotting. So when the sample is taken, you need to invert the tube gently to prevent breakages or breaking of the red cells. So you invert it gently so that it will mix well with the anticoagulants, because the purpose is to prevent the sample from clotting. If you don't have the roller at the facility, then you use you put the sample in your palm and then you invert it gently, not vigorously shaking it. When you vigorously shake it, you break the red cells, which will affect the test results. Breaking the red cells can either increase the hemoglobin level or decrease the hemoglobin level depending on what happened. And then it will cause hemolysis to the blood sample. Hemolysis normally affects the laboratory results. So you shake it or you invert it gently without breaking the red cells. But at a facility where there's a roller, you just place the sample on the roller and then it will mix the sample, the blood sample with the anticoagulant so that there wouldn't be any clotting. Then let's look at sample transportation. This happens when the sample is taken at the facility before being transported to the laboratory for the laboratory test or for the laboratory investigation. You either transport the sample in a cold chain, so that the biomedical transport the sample in the cold chain. If you don't have the cold chain, you can create one by using ice pack. If the sample is not supposed to be transported to the lab at a temperature of 2 degrees to 8 degrees Celsius, this will maintain the biochemical properties of the sample to retain it so that it can be used within 12 to 48 hours. and then the results will come out to be accurate and then reliable. One of the errors at the pre-analytical stage is using the wrong sample collection container. Maybe you want to run a methodological test and then you pick the sample into the gel tube or the serum separator tube. After picking the sample into the gel tube, you quickly remember that no, this one is a methodological test. So then you pour it back into the EDTA. You pour it back into the EDTA. This will affect the results, and then the results will come out to be not reliable and that accurate. Or you pick, you know you are going to run a chemistry test. You pick the sample into the EDTA. Then you quickly remember that no, I'm going to do a chemical test, so let me put it into the gel tube. Then you pour the sample back from the EDTA into the gel tube. It is not done. When you do it that way, the results will come out and then you will not get a reliable results. All this happens at the pre-analytical stage. This one is, it happens where the sample is being taken from. If it is taken from the facility before sent to the laboratory, these errors could happen. It could also happen in the laboratory, but mostly it happens when the sample is taken before sent to the laboratory. Dr. Olumide, your hand is up.
Wanted to comment on the collection of urine samples. The technique of collecting I was taught is that first of all, there are special containers which needs to be sanitary, and midstream, the collection needs to be midstream rather than from the beginning of the passing of the urine. That's when the sample is being collected directly from the patient. That could lead to error, right?
Yes. So for urine collection, you need a sterile container. A sterile container that is sterile should be used. You don't pick any containers. Maybe you go to the market, you have a container that was used for there was a cream in a container. The cream is used up, and then you use that same container to pick the urine sample. It is wrong. When you do that, it will affect the result. It could cross-contaminate the urine sample. So we normally use the sterile container. A sterile container, a container that has not been used before. It is sealed. It is sterile. That is what is used to collect the urine sample. And then the sample is collected midstream. You pass the first urine out, and then the midstream, you pick the sample. And then the sample needs to be transported to the lab within 1 hour. You don't keep the sample at the facility for that long. When you keep the sample at the facility for that long, there will be microbiological growth. Microbes will grow in the sample, and then it will affect the results. So when all these things are done before the sample is taken to the lab, the scientists there have no idea how the sample was collected. So the sample that you give to the scientist will produce the same results that the sample came in with. So when the samples are not collected well, the results that will come out will also not be that accurate. Collecting of urine samples, we need to prevent cross-contamination. We don't use the chamber pot or the bed pan to collect urine samples. If the client is in the catheter, that one is fine. The catheter is sterile. You pick it, but not even the sample has been kept or the urine has been kept in the catheter for more than 1 hour. You pick fresh sample. Or the urine bag. When you are collecting the sample from the urine bag, it shouldn't be kept for more than 1 hour. You collect fresh sample from the urine bag.
Mr. Emmanuel Kwasitete, mute your mic, please.
Dr. Charles Menu, your hand is up. Dr. Charles Menu, your hand is up.
No, please. It was the first one.
What happens to identification mistakes or identification error? What will happen to that sample? When a sample,
Oh, I'm what?
a sample collected with wrong identity, what happens to that samples? After the sample is taken to the lab.
You can have cross or mismatching of the results.
Perfectly right. Mismatch of the results. So all these errors can be prevented. Then we have the analytical phase, the core testing phase, where the sample is analyzed using calibrated equipment, following strict protocols and quality control measures. So this stage is where the laboratory scientists come in. The scientist is supposed to follow the protocols, the standard operation protocols, do the daily quality control checks. For instance, you are supposed to take 1 ml of blood sample and then you take 5 ml. It will affect the results. This is a personal experience that I had with a colleague. A colleague was running HbA1c, that is a glycated hemoglobin, and the colleague was supposed to take 0.10 microliters of the whole blood. So the person picked 0.20 microliters, and then the results came out to be high. The results were sent to the prescriber or the physician, and then the physician, per other investigation, realized that the results is not matching. So asked the client to go back to the lab to do the test again. This time around, the client was sent back to the same laboratory, and then the test was done, and then the results came out as expected by the clinician. So the clinicians called the laboratory personnel there and asked what happened. And it was realized that the volume of sample that was taken was more than what was supposed to be taken. So measurements also play a role at the analytical stage. These errors mostly happens when the technician or the scientists working do not follow standard protocols and then procedures. Then we have the post-analytical error. That's the final phase involving results interpretations, validation, reporting, and delivery to the clinicians. Errors can arise from manual data entry or miscommunication during results transmission. So the test is done, everything was done well, protocols were followed, but during the results reporting, the person was supposed to report FBS, fasting blood sugar of 4.6. For one reason in the person typed 14.6, and then the results went to the prescriber. The prescriber used, and they happen at the post-analytical stage. So doing results reporting, it's another personnel at the lab who need to validate the results before the results. Any questions so far? Dr. Henry?
Not a question.
Yeah,
Can I?
good evening and thank you for giving me the opportunity. I just want to find out that, and we, with all that you've said, can we sometimes also conclude that there is not always the problem with the the lab technician coming out, and it may be from our hand or whoever took the sample. Because if the sample is not taken very well, and then it is sent to the technician who is going to run the test, and also do not know how the test was taken. If, in effect, whatever results may come out will not be. So you may, if let's say I am the one doing this, I'm taking the sample and then sending. I've sent to first lab, they've run the test, and I've also taken to, two more lab facilities, and they all run the test. And I compare, and it's not matching. Will it be from the end of the lab, or would it be from my end? So in effect, can we say that we sometimes also contribute to the wrong results that come, or the results that come that are not what we expect? Thank you.
Okay, Dr. Kidash.
Okay, just for the pre-analytical stage, error can also be obtained when transferring patient information to a logbook or data sheet. Yeah, that is also important.
Perfectly right. Eunice. Eunice.
Please, can you hear me, please?
Go ahead.
My question is, with comparing with what you are presenting now, I wanted to know those who use the magnetic analyzer for this quantum for screening. You know, with the lab aspect, we are talking about the stages of taking the sample and then the final stage. But with them, they don't have these pre-analytical and then the final stage. So with their machines they are using, is it authentic? How do we know if the result is authentic in contrast to what we are presenting now?
Your question again.
Okay, please, I was saying that with the lab test, I mean the stage in the sample collection, we are talking about the pre-analytical stage and the final stage. And I'm asking that comparing to those who use, I don't know if you know about the machine I'm talking about. There is a machine called quantum magnetic analyzer that those who deal with the supplement they use.
Quantum.
And then they prescribe products for patients or client they screen for. I wanted to ask that their results in contrast with the lab, is it authentic? Because with the lab they go through all these stages, but with them they just go directly to the screening.
Okay, now on a machine
Okay, I don't really know
Okay, let me answer here.
much. I don't really know much about it.
Okay, all right. So the quantum analyzer, when you take the machine, the manufacturer, it is clearly stated that it is not a diagnostic tool. So you should know that it is not a diagnostic tool. It cannot be compared to a standard laboratory test. So quantum magnetic resonance or analyzer is only it's not a diagnostic tool. You cannot use it to diagnose anyone. So yeah, there's a problem, and the quantum tells you that okay, there's a problem with the kidney, whatever. You can only confirm this with a standard laboratory results investigation or conventional investigation. You cannot use any diagnostic machine in alternative medicines to confirm or diagnose anyone without confirming from the standard diagnostic imaging tools that we have.
Okay. All right.
Because
Thank
the
you.
manufacturer has clearly, yes, it is clearly stated. They've issued a disclaimer. So if you're a practitioner and you use it and you, for instance, you disregard the disclaimer and you go and tell the patient that, okay, I use quantum and quantum is saying that you have kidney disease or you have this. And later the person go and then confirm from a standard diagnostic or a lab and it proves to be otherwise, you can be held responsible.
Okay. Thank you so much.
Now, Banyayano.
Doc, can I come in?
Yes, go ahead, Christiana.
Okay, so I had an encounter of this kind of case within this week. This is a client whom I've been handling with a case of prostate. And by grace, his PSA was so elevated, and then by grace, it dropped back to, within the normal range. And apparently, he went to a different practitioner who used a quantum machine to check him. And he called me in the night. And, you could hear from the voice that he wasn't happy, that the doctor said he had developed prostatitis. So what I did was I issued him a request to go to the lab and have some tests done, PSA, he did urine RE, and then we did a scan. And it came out that everything was excellent. He never had Prof said. We could use it, but
the PSA, maybe you get the, but if you have prostatitis, Kaddish, if you have prostatitis, your PSA can be elevated. It's just inflammation in your prostate. So the PSA itself is not this laboratory investigation. You'll get the
Okay. So let's look at the laboratory request form. What is the laboratory request form? What is the laboratory request form?
So it's the form that has all of the lab tests that
Yep.
are done written on it.
Laboratory request form.
It is a form that specifies exactly what tests the practitioner would like to be carried out by the patient when going to the laboratory.
Laboratory request form. What by it's a form used by healthcare professionals to request laboratory tests. So with this laboratory request form, you need requirements. Professionals must be familiar with the various laboratory tests, including their purposes, required sample type, and any special handling or preparation needed. This knowledge ensures that the correct tests are ordered based on the clinical indications. Accurate completion of the requisition form or the request form is vital. This includes ensuring that all required field, so let's look at the field, the patient identification, test code, clinical histories are filled correctly to avoid error in processing and reporting the results. Filling of the laboratory request form. 1. Patient information. Print clearly using pen. Avoid script writing or script handwriting, like stylish handwriting. Enter the full name on the form. Last name, first name, and then the middle name or the initials should be on the form. 2. Requesting physician or prescriber's signature or name should be on the form. So with the requesting physician's name or signature, you write the first and the last name of the requesting physician. Mark the gender, that is the sex, as male, M, F as female. As many tests are sex related, many tests are gender related, and then age related as well. 3. Specimen information. Record the dates and time when specimens were collected. This is when the sample is being taken from the facility before it is being transported to the lab. And then 4. Retain copies. Keep a copy of the request form for your records before submitting it to ensure you have all necessary information documented. So all these things need to be documented. You are keeping a copy because after you've sent the request to the lab, you need to know what test you requested for. So when the tests come in and there is different from the test you requested for, you will know, and then you can refer to it. If you don't have the copy and you request for HB or HB estimation, hemoglobin estimation, and then the test come in as RBS, random blood sugar test. Since you don't have a copy, you have no case to challenge the test you requested for. The technician might say, oh, the request that came in, it was RBS, not HB or hemoglobin estimation. So you need to keep a copy of the test you have requested or the request form, and then document all the necessary information in your book. Is it clear? I'm showing you a copy of a laboratory request form. Can you see my screen?
Yes, sir, but that one is not clear.
Can you see my screen?
That's not the form.
Yes. This is a copy from a facility. So let's look at the points that we mentioned. So with this copy, you are supposed to know the test you are requesting, either hematology, microbiology, parasitology, histopathology, or clinical pathology. So you mark it since you have an idea of the test you are requesting, and then the branch of laboratory investigation it falls under. Then you indicate the cell name boldly, then the other name. That's the first name and then the middle name. Boldly, and it should be clear for you to be read. The age should appear, and then the gender should appear boldly and clearly for it to be read. Then the clinician identity, the one who is requesting. If it's a doctor, the signature and then the name supposed to be there clearly. Date of request should be there clearly. Material and test should be stated clearly. You are requesting for urine RE, urine routine examination. So you state urine clearly there, and then you go to the laboratory investigation that it falls under. Then you take it over there. This is a sample. You can create your own sample that will suit and have all the necessary informations that we've talked about on it. If it is electronic, you create it and then you put all the necessary information on it, so that when the request go to the lab, it will be easy for interpretation, and then the test will be run and it will come out with correct and accurate, precise, proper diagnosis and then treatment. Any question on the laboratory request form?
Not a question, just sharing. Here
Okay,
in
go ahead,
Jamaica, Kadish, here in Jamaica, in our labs, what we have as the lab request forms is a little bit more complex. We have different sheets and they're color coded for the different areas, right? Whether it be microbiology, virology, chemical pathology, they're coded in terms of the color. And then the specific sheet now would have lined up the different tests that are done in that area. For example, hematology, you would have hemoglobin, CBC, all the different tests done in the hematology department would be on that sheet, and that sheet would be white. And all the details you show on the screen here, that would be on the top of the screen. Yeah.
Okay, that's fine. Any question or contribution? So let's look at reference values. A reference value is a standard or normal range used to compare results, helping determine if the result is normal or abnormal. And we have an example over there. Hemoglobin estimation. Male adults, 13.0 gram per deciliter to 16.0 gram per deciliter. Female adults, 12.0 gram per deciliter to 15.0 gram per deciliter. So like we said, some tests or laboratory investigations are gender related and then age related. So hemoglobin reference range for a male adult is different from hemoglobin reference range for a female adult, and then for a child, for an infant, etc. So this is just an example. So when a laboratory request is made and then the sex or the gender is not stated or the age is not stated, the results might come in which you need to compare the reference ranges to see if your results is within the normal range or is abnormal for you to take a decision on what to do. So every information is very vital for laboratory investigation and then for results interpretation. So we'll take one test and then we'll Dr. Philip, your hand is up.
Yes, please, Doc. Thanks for the opportunity. I would like to find out. You see, the reference range values. We have some. Is it G/DL? What does those units represent? I don't know.
Okay, I think that one is a typing error. It's supposed to be gram per deciliter. That's the 15 for female adults. Is gram per deciliter. That's the unit for the hemoglobin estimation.
Oh, okay.
Yeah. Dr. Olumide.
Yes, thank you. Thank you for the opportunity. I put the question in the chat with regards to the lab result report. Should it be given to the patient or should it be sent sealed to the requesting practitioner? What are the ethics around that, please? Am I clear?
Okay. You are clear. Let me take Teresa. And then we'll combine the both and then answer. Teresa, your hand is up.
Hello, can you hear me? Good evening. Hello, good evening.
Good evening. Good evening. Go ahead. We can.
My question is that those of us who are not in the laboratory and those science things that we are just learning to become the doctors, how do we create our lab forms? Is there a standardized place you go and request and they make it for you so that you see this limit, this from this to this, that percentage and that sort of way. That's what is beating my mind. Hello, am I clear?
Sure, you are clear.
Okay, thank you.
Okay, so let's answer Dr. Olumide's question. She was referring to if the laboratory results should be given to the client or should be sent to the requesting practitioner. So it's a question that I would throw to the class.
A request. The laboratory request and then they find out the report itself.
The report itself should be given to the practitioner directly or should be given to the client. Dr. Emmanuel Ba. This is perfect. Dr. Kidash also want to add up. Johnson.
No. I think Dr. Olumide, what is the practice in Belize? What is the practice in Belize? Then I think Kadish, you can also tell us the practice there, the standard practice in Jamaica.
Yes. Our standard practice here, because we have a health information system where in the public system, right, where the information is fed electronically to the prescribing doctor. That's in the public health system. In the private practice, it is put in a sealed envelope and for the patient to carry it to the doctor with a stamp on it so that the patient cannot open it, right? There are situations when a patient can go in privately and ask for results. And in that case, in that situation, the feedback is given directly to the patient, as the previous commentator mentioned. But when a prescribing practitioner requests a lab, that information is sent directly to the practitioner for interpretation and explanation to the patient. Thank you.
All right. Madam Kadish.
Okay, same in Jamaica as she explained clearly. However, just elaborating on what the person before was saying about if you want to request a test to be done, you go to the lab and ask for a test to be done, hence the report will be given to you. That is not done here in Jamaica. No one can enter a lab and request that a test be done on them. It has to be referred by a practitioner.
So can a traditional healer in Jamaica or a natural medicine practitioner in Jamaica request for laboratory tests on that?
Yes, yes. And many of them would get the lab request forms from different hospitals or private, other private areas. Well, the lab itself, different labs.
But I mean, a traditional healer, can a traditional healer request?
Yes, yes, they can. But they don't have a form for themselves, unique to them. They get other forms from different labs.
Okay.
Yes.
The same is true here. The same is true here. The labs have forms that can be used. Correct.
Okay. So your facility, so if you operate a facility, your facility can develop a lab request form, right?
Yes, it can. It can. But because they're officially, printed and designed already, we just use what is there and tick off the various requests for the specific tests that are required.
Okay, all right.
Dr. Kingsley, your hand is
Hello,
up.
Doc. My hand is up.
Yes, go ahead.
Thank you. I'm Kingsley Amaboji. I have this experience to share, for which reason maybe at the end we will draw a conclusion that it's ideal that the practitioner is sent the request report. There is this woman who paid a visit to my facility, and she was having this problem of hypertension. The cholesterol was always high. She was obese. So I requested that she conduct a test. I gave her the lab request form. She even assured me that there's an insurance company where she contributes to. So when she goes for the lab test, they will be paying for it. I waited for this lady. She didn't come back with the results. I questioned her later, and she told me when she went to do the test, they gave her the results and the treatment. For which reason, personally, I've resolved that there's only some 2 private laboratories where I send my people to go and conduct the test, and they send me the results directly. So with this experience, wouldn't it be appropriate that we, the practitioners, after the request is made, request from the various laboratories that they should send the report to us per WhatsApp or electronically? Thank you.
Okay. So these arrangements can be done. It can be done between the laboratory and then the requesting prescriber. But also the client or the patient need to be informed that your results will come to the requesting prescriber so that the client wouldn't be worried about the results. If not so, then the client will go back to the facility or the laboratory and then will be requesting for the results to be given to him or her.
Yes.
Dr.
May I say
Samuel,
something? Okay, sorry. I didn't see his
Samuel,
hand.
please go ahead.
Okay.
Okay, so thank you. Like for the contribution to Dr. Olumide's question, per my experience and what the government hospitals have been doing, I know that it depends on various factors, and the factors they mean that it depends on the sickness or the disease. So if like a lifestyle disease, then he will give the report to you. Because let me say, if you have a kidney problem and or a kidney failure, or a kidney disease, high blood pressure, and so on and so forth, they will give it to you because you is going to treat yourself with the lifestyle or the diet that you are going to choose so that you can be cured. Whereas when you have cancerous cells, because of the perception and the norms about the cancer patients or cancer treatment and how it is chronic and uncurable, they will not give the report to you, but they will rather find a ways and means to seal it or to tell you to go home. They will send it to the practitioner or whoever sends it to you. So in a nearby government hospital, what they do is when you come in for common tests, they will do it for you personally. Like I'm the patient, I went to the lab facility to request for a lab. They will check what you are coming to do. And most of the time, they will accept or ask you for your background. That's the first question they are going to ask you. If you are a practitioner, who is sending you here? So if like it is malaria, they will direct you to go to the OPD first so that the doctor can mean like they will teach you whether it should be malaria or typhoid fever. But you can't go directly to request for. If like it's HIV, it's fine, they can do it for you. But if it is a serious thing, I mean, they won't give it to you, but they will give it to the practitioner. That's my experience and what most of the doctors have.
Yes, may I?
Dr. Olumide, please go on.
Yes, it seems to me that there is a gray area with this issue, and I'm questioning if there is a code of ethics for lab technicians, because you don't know the state of mind of the client. And if the information, yes, if the client has come in personally to make the request, that is fine. However, if it is being prescribed by a practitioner, it is a matter, in my mind, it's a matter of ethics to respect that practitioner and communicate and let the practitioner be the one to communicate to his or her client what it is that he is suspecting or what he or she wants to work with the patient as to what it is that will happen in the next step. So my point, then there's a need for a code of conduct if one doesn't exist for lab technicians. Thank you.
Okay, so let me come in with this. For the general practice here in Ghana, when the request is made, either by electronically or by a request form, and then the request form comes to the laboratory, and the test is run, the results either goes to the client directly or goes to the requesting prescriber, depending on the arrangement between the requesting prescriber and then the laboratory service provider. If it is a private, they might give the results depending on how the result is to the client. If it is something that needs a further interpretation where you think the client might open it and then interpret results by himself, then you don't give the results to the client. You communicate with the requesting prescriber or the clinician, and then the results is sent to person prescriber. But if it's a laboratory investigation that the client walk into the facility, a private facility, and request for urine pregnancy test, an example, and then the test is done, the results is given directly to the, since the client made the request by herself without a prescriber requesting for it. So this is the general practice within our health sector in Ghana here.
Mr. John Jabba and Mr. Yumadodu, kindly mute your mics, please.
Dr. Olumide, your hand is up.
I'm sorry, I took it down. I was finished. Thank you.
Okay. So let's look at the reference range. The reference range are standards. They come with the laboratory results, and then we use the results to compare the reference range to determine if the client results is normal or is abnormal. That is, either it's within the normal range or is outside the normal laboratory reference range. And this reference range helps the clinicians to decide the way forward for the clients. So not all laboratory test results come in as positive or negative, or present or not present. Some comes in and falls within a reference value. These reference values helps the clinicians to determine the line of treatment for the client. And it is very useful for the clinicians. Some treatments do not need drugs. They only need lifestyle modifications. So this reference range helps the clinician or the prescriber on what to do. If you need a lifestyle modification and you run a cholesterol test, that's lipid profile, and then you are outside or near the borderline, the clinician will decide what to do for you, either to put you on some lifestyle modification, and then you are good to go. So the reference range is very important. And the reference range also indicates
baseline.
Do we have a hand up?
Mm-hmm.
Dr. Olumide, your mic is on. So it's very important to compare the results with the reference range. When the results comes in without the reference range, it is unacceptable. The results are supposed to come in with the reference range. So when you request a lab test and it comes in HB, hemoglobin estimation 3.4, without the reference range, do not accept that result. Every laboratory result is supposed to come in with the reference range and then with the correct standard units. Okay, so we are about ending the class. I will take about 4 or 5 questions and then we'll end today's class. Or any contribution to what we've done today.
Okay, so a little bit more elaboration for our lab request forms. I did say that they're color coded and for the various departments, and they would have listed all the tests done in that department. And for some of them on the back of the sheet now, you would see more description as to the tests that are requested. Because for the practitioner's sake, for it to be easier for them, it would be easier to not just tick all the individual tests. For example, you want to test for the electrolytes. You know, you don't want to tick off all the electrolytes on the sheet. They would have a description of, like, say, electrolyte panel, and that sums up all the electrolytes that should be requested. On the front part of the form, you would say electrolyte panel 1. Like for an executive profile, of course, that's another description. Yes, they just put executive profile, and they have 2 types, executive profile 1 and executive profile 2. And of course, there's a description as to which tests are for each.
Okay. Any further contribution? Any other contribution or question?
Yes, yes.
Okay.
I did, thank you. I did a project a couple years ago for self-care management of diabetics. And it was recognized that tests like the HbA1c is more efficient in terms of determining the state of the diabetes of the patient compared to the glucose fast testing, right? So I just wanted to share that. But however, the HbA1c is a more expensive test than the glucose. So it is useful for the practitioner to be aware of which tests would be the most effective, which one would be the most cost efficient for the patient. Yes, thank you.
Hello, Doc.
Go ahead. I can see your hand. Amevo Kingsley. Kingsley Amevo. Okay. So I want to add up to concerning the HbA1c. It's always good and very reliable to request the HbA1c for the confirmatory of diabetes. Because that one comes with a complete information on how the glucose or the sugar molecules are bound to the blood in the individual. But with the FBS or the RBS, it is only measuring the glucose level in the blood. But the HbA1c is a confirmatory test for the diabetic diagnosis. Thank you.
Okay, Doc, thank you for the opportunity. Mine have to do with
your hand is up.
This.
Kingsley.
Yeah, please. This is Kingsley Amaboji online. I'm asking a question. With regards to this modern equipment, I'm told that there's one which is even 4-in-1. You can use it to check the blood sugar. You can use it to check the uric acid and the hemoglobin level and others, without going through the hectic laboratory activities. I would like to find out from you your recommendation about us practitioners procuring such equipment. Thank you. Please, I'm done. It's my question
Your question
clear?
again, please.
I'm asking that there are some of these modern equipment. I'm told of one which is even 4-in-1. You can use it to check the uric acid, the HB level, the blood sugar. And I want to find out of your recommendation or your thoughts about us going in for such equipment. I'm told you can use it at ease like we're using the glucometer without going through the strenuous laboratory activities. What's your recommendation, please?
Okay, so these equipment are for point of care test. So after you've done this laboratory investigations with this equipment, you need to do confirmatory tests with the analyzers. So if you have a facility, you can still purchase this small equipment as a point of care test. But for confirmatory test, you need to request, and then the test should be run with the chemistry analyzers for a proper diagnosis.
Thank you, sir.
Any other question or contribution?
There is another question, Doug. Good evening, Doug.
Good evening, Ima.
Yes, sir. My question is, tying a tourniquet for up to 1 minute or more while collecting blood sample, does it have an effect on the coagulation profile? Of the
Yes, you
patient?
do.
Okay. That means it will give a wrong result as well.
Yes, it could affect the results because this could change the analytes of the sample. It could increase some of the electrolytes, like the potassium, the calciums in the sample, and this could affect the laboratory results.
Okay. Thank you.
I'll take Kingsley and then Emmanuel then. So Emmanuel. Hello. Yet that mommy will. your contribution. Thanks for your contribution. Okay. Any other question or contribution? So, with what Emmanuel said, the laboratory needs to be run by a qualified personnel, a certified one, the one with the licenses from the Allied Health Regulatory Body. So you can't just open a facility and then start running laboratory investigations over there. You need to go through the process and then the standard for you to be accredited before the laboratory investigations can be done. So if you have plans of opening a facility, then you need to contact the regulatory bodies so that they will come in and then inspect your facilities, license you, then you could look for the service of a biomedical scientist who can run the facility for you. In the absence of no other questions or contribution, we will bring the class to an end.
Thank you, Doc. May the Lord strengthen you.
Thank you, Doc. Thank you, Doc. God bless. Have a wonderful day.
You too. Bye-bye.